Hello, and welcome everyone to the first of Syntero's Caregiver Connection three-part Zoom series. My name is Lucy Smith, and I am the Special Projects Coordinator for Syntero. Our agency has been providing outpatient mental health and behavioral health services in our community for more than 40 years. Older adult services, as well as services for caregivers, have long been a part of our valuable service history. During the past 14 months, we have learned even more acutely how important it is for people to stay connected. We've been challenged to seek out, embrace, develop, and learn new ways, sometimes unfamiliar ways, of sharing information, trying to minimize the isolation and the stress that has been so exacerbated by the pandemic. According to a 2020 report on caregiving in the United States, which was published by the National Alliance on Caregiving, a greater number of adult Americans are providing care for a neighbor, friend, or relative. The needs of the care recipient are more complex than previously reported by caregivers. And caregivers often feel underprepared or inadequately supported to meet the needs of those for whom they are caring. Additionally, while a majority of those caregivers, in fact, 53%, feel that their role as caregiver gives them a sense of purpose or meaning, the positive feelings are often coexisting with feelings of stress or strain. This Caregiver Connection series was developed by two of my colleagues with myself to help address that isolation and stress. Personally and or professionally, we have each had the opportunity to serve in the role of caregiver. We wanted to provide accurate, up-to-date, and helpful information to anyone who is fulfilling the challenging and magnificent role of caregiver for a client or a loved one. Our message is simple. You are not alone. Our hope is that you will find renewed energy and information, and most importantly, connection over the next several weeks. We're thrilled that you've joined us today. A few simple reminders before we get into the formal presentation. We will be recording each of these sessions to be uploaded to a website for access at a later date. If you do not wish to have your image recorded or portrayed, please make sure you disable the video function on your computer. We also welcome questions, but we respectfully ask that you wait or that you utilize the chat function on your Zoom to pose those questions. We will pause periodically so that the presenter can address any questions that have been posed via chat and make certain that your questions are answered by the end of the presentation. I would like to now introduce a longtime colleague, my coworker, Dan Brochetti, who is a licensed independent social worker. Dan has served in the role as Syntero's caregiver consultant for more than 20 years. Today, we will be embarking on learning about community resources and help in the community. Dan.
Okay. I'm sorry.
Okay.
Slideshow.
Hi, everybody. My name is Dan Brocchetti, and I'm a social worker at Syntero's Caregiver Consultation Program. The Caregiver Consultation Program is designed to help caregivers of older adults. Some of my clients include adult children caring for parent or parents. Many of them are spouses caring for a husband or wife. And I have a lot of grandchildren who are primary caregivers for their grandparents. My role is to provide my clients, caregiver clients, with information about caregiver older adult community resources or support programs. And I also provide supportive counseling education around care for caregivers and to help them learn strategies to reduce caregiver stress. There are a variety of community resources to help caregivers, and that includes caregiver respite, senior companion programs or friendly visitor programs, home health care services, and home health care can consist of a homemaker. Homemakers focus on helping older adults with chores and errands. If you hear the word or see the word personal care aide or home health aide, those are home health care workers who help older adults or even adults who are disabled to get bathed and get dressed. Home deliver meals, emergency medical response systems, transportation to medical appointments and grocery stores, adaptive equipment. Those are just some examples of what are called community resources to help caregivers. And that also includes adult day health care. Unfortunately, many adult day healthcare centers are still closed, but in the long run, the plan is to slowly begin to reopen adult day healthcare. I'm looking forward to that happening because it provides respite for caregivers. One way to start with community resources, learning about what's available, and then actually getting the service implemented or started, I would recommend starting with the Franklin County Office on Aging. It is a program that helps older adults and caregivers who reside in Franklin County. The age requirement for older adults is anybody 60 years of age and older. And then they can help any caregiver who is caring for somebody 60 years of age and older and resides in Franklin County. This is their contact information. One program that I like to highlight for Franklin County Office on Aging is called Senior Options. And the reason I like to highlight this for my caregiver clients is because Senior Options has case managers, caseworkers who help older adults and caregivers arrange the services that's required in the home or in the community. So they can do the work for you. They can make the phone calls, make the referrals to the provider agencies, whether it's home delivered meals, adult day health care, home health care, emergency medical response system. There's a lot of provider agencies, and a lot of caregivers do not have the time to make many phone calls to all the provider agencies. The Senior Options staff can do that for you. And then another major advantage to the Senior Options program is that at the Franklin County Office of Aging, there is a financial assistance or subsidy program that might be available to help older adults pay for the services. It's a sliding fee scale based on income and savings. So that subsidy or financial assistance, if it's available, if the older adult is eligible for it, can lower the cost out of the pocket expense. And that is very necessary for a lot of older adults. They may need home health care, but can't afford it. They might need it 3 to 4 days a week, but can only afford 1 day a week. So with the subsidy, they might be able to increase it to 2 or 3 days a week. In addition to the Franklin County Office on Aging, I always like to highlight to my clients the Central Ohio Area Agency on Aging, also called COAAA. This is their contact information. They're located on South High Street. The COAAA, or Central Ohio Area Agency on Aging, covers the 8 counties that make up Central Ohio. And here's some of their programs. They have the Passport Program. Passport Program is a program that provides in-home care services, home delivered meals, transportation, medical appointments. The difference between it and Senior Options is that the Passport Program is a Medicaid program. So all the services are being paid by Medicaid dollars or Medicaid funding. And in addition to the Passport Program, the staff at the Central Ohio Area Agency on Aging can help older adults and caregivers learn about the Medicaid Assisted Living Waiver Program. That's Medicaid funding money that can be used to pay for assisted living care. There's eligibility criteria that has to be met in order to take advantage of that. and their staff can explain that to anybody who calls to find out about eligibility criteria. I also like to highlight COAAA because it has a really good older adult resource guidebook that many of my clients are still using. It also and in that book are a listing of all the home healthcare agencies that are within Central Ohio, other home delivered meal programs, just a range of services, housing, adult day healthcare, legal assistance. So it covers a wide range of topics and subjects. And I would highly recommend having a copy of that book available to you at all times. For veterans, I always like to highlight and emphasize the Franklin County Veterans Services Commission. You could also go to the federal VA service, but you could also start with the Franklin County Veterans Services Commission. It's located downtown Columbus, East Broad Street. There's their phone number there. And it's a good way to start to learn about benefits that help veterans. And some veterans can qualify for benefits that can be used to help pay for home care, prescription drug delivery, and other in-home services, durable medical equipment, financial assistance to help pay for utility bills, adaptive equipment. So there's a range of services available to veterans. But the best way to find out is to contact either the Franklin County Veterans Services Commission or the federal VA and start talking with one of their case managers, case workers to learn about benefits and how to go about applying for them. If you have questions or concerns or need information about Medicare and Medicaid, I always recommend it's my clients to contact the Ohio Department of Insurance. It is a state government agency that has employees or staff that can help people learn about Medicaid, eligibility for Medicaid, and all the different Medicare plans. There are a variety of Medicare plans, and they can guide people. They can't tell you which one to use, but they can help highlight all the different programs, the benefits of each one, and then you as a consumer would decide which one you would want to take advantage of. But they're good educators. They can answer a lot of questions you may have and explain eligibility criteria. And they're available through the Ohio Department of Insurance. You may also need to contact the U.S. Department of Health and Human Services. There are a variety of agencies that come under U.S. Department of Health and Human Services, the National Institute of Health, the National Institute of Aging. I go to those resources. I have resource books from each one of those agencies that I give to my clients if they request it. Health information, healthy lifestyle information. What I've discovered is that what can be very helpful for caregivers to reduce stress, reduce anxiety, take good care of themselves is education material on staying healthy, staying strong, coping strategies. And the printed material, I think I have copies that I keep available, and I think you would find it very informative, beneficial to read some of the strategies and suggestions from aging and health agencies. Here's some others, Food and Drug Administration. I like to highlight that because my father worked for the Food and Drug Administration before he moved on to pharmaceutical companies, but there's the Centers for Disease Control, National Institute of Health, Centers for Medicare Studies. There's many others, and it's a large government agency, so you may have to set aside some time to explore each division or department that comes under Department of Health and Human Services. For more local available services and resources, this is an agency. It's called 211. It's like an information and referral service. You just dial 211 on your phone. And if you need information about emergency financial assistance, help to pay utility bill, maybe adaptive equipment for your home, a ramp, grab bars, one way to find out what may be available would be to call 211. And here's the phone number for it. And here's some other services. They also have information about programs for people, younger age groups, adult care, youth programs, health care, mental health counseling, community and government specialized agencies, just a variety of services, emergency food, clothing, and furniture. So it's called 211. The Ohio Health Network, it can be very helpful and beneficial for caregivers and older adults. and especially their senior health clinics. Ohio Health has two senior health clinics. One is called the Gerlach Center, and the second one is called the Dempsey Center. And these are senior health clinics that specialize in helping older adults and caregivers around a variety of health-related issues. A lot of it deals with dementia and other types of Alzheimer's and other kinds of dementia, head injuries, chronic health conditions that are resulting in impairment in a patient. And they can help older adults and caregivers understand also medications, how medications might be affecting one's health. They do thorough, comprehensive medical examinations, evaluations, looking at a whole range of issues and to help people understand, for example, what stage somebody might be at who has dementia, if it's early, middle, or late, and help older adults and caregivers understand symptoms at each stage. So they're very good educational centers. And again, one's called the Gerlach Center. The Dempsey Center is located inside Riverside Hospital on the first floor. And here's information about the National Institute on Aging in Bethesda, Maryland. I contacted them recently, and they mailed me many copies of brochures and information booklets that deals with exercise, diet, nutrition, and aging. And I make this available to my clients if they're requested. So again, it's called the National Institute on Aging. If you have the time to explore their webpage, I think you'll find it very, very helpful. It also includes information on Alzheimer's disease and other kinds of dementias. And also, if you look at that website, you might be able to find out about some of the most current up-to-date research that's being done and try to understand what causes dementia and possible treatment options in the future. Here's some more information on the National Institute on Aging. There are print materials, training opportunities, labs, grants, funding, things that might be that they're doing, planning for the near future and for the long-term future. Some caregivers need information about the mental health network, Franklin County and Central Ohio. There are a lot of providers that make up the mental health network. And one way to begin to understand where the providers are, what their specialty or focus is on, would be Mental Health America, Franklin County. So here's information for Mental Health America, Franklin County, located on West Fifth Avenue. Call to find out about services. You can also call to get information about support groups, mental health education support groups. And support groups for individuals and families, the referral network at both the state and county level, and treatment services for mental health disorders such as anxiety and depression. Aging network is extensive throughout Franklin County and Central Ohio. So a lot of caregivers are looking to connect with other caregivers. It's not easy because of the pandemic and closings, but there's still a way to connect with caregivers through caregiver websites, Facebook as a way to connect with other caregivers around the country. So look at websites. One website that I go to more than any other is called Today's Caregiver Magazine. It has a website that deals with care for caregivers. So look at that if you want to see what other caregivers around the country are doing to cope with caregiver-related stress and learn about services and resources. And Facebook is also a good way, and websites are also a good way to learn about coping strategies. A lot of people like to cope with stress and anxiety through art and music. Again, exercise is very helpful and beneficial at reducing stress, caregiver-related stress. So stay connected in a variety of ways with other people, and support groups can have some ideas, strategies on what you can do, and give you the encouragement to do it. There may be activities that you have done in the past, but maybe you haven't done for a long time because you're so busy being a caregiver. My recommendation, the recommendations you would see on a caregiver website, recommendations you might see in a book about caregiving written by caregivers is you have the right to take care of yourself. You're not being selfish, uncaring, or irresponsible if you set aside more time to do that. And so if anybody had any questions about anything I mentioned, this would be your opportunity to ask. There are a lot of resources, aging, health, and mental health. And I'd be happy to go over each one again as often as necessary. And that's what I enjoy doing. I find it very rewarding, explain services and resources in more detail. I have that information that I make available to my clients. I also do a lot of follow-up mailings with my clients. I have brochures, flyers that I put together for a mailing for them. I put it in highlight yellow with the program they might want to start with first, because caregivers have a limited amount of time. They may only be able to make one phone call a day. And so I'm in a highlight yellow. I'll start with a program they might want to start with first, to make a phone call to learn about a service or resource. And again, here's some books about caregiving that have been written by caregivers. One that I have looked at many times is called Caring for Yourself While Caring for Aging Parents. It's a very good, helpful book. There are many others. Sometimes the author is a spouse who wrote about caring for their husband or wife. Sometimes the authors are adult children who wrote a book about caring for a parent or parents. They're all very good. They all have helpful strategies, ideas, and suggestions on what you can do to reduce caregiver stress, reduce anxiety, and take good care of yourself. Take better, re-energize. And so think about one of these books, or if you don't have time to read a book, which a lot of caregivers do not, try the websites. Just type in caregiver, and there'll be many, many different options to choose from. You may have to set aside enough time to navigate each category or section until you find a website that you find the information that'll be most helpful and beneficial for you. And then other ways to learn about services and resources as well as care for caregivers are these hashtags here that are listed here. So start with the Syntero Cares. That is a listing of all Syntero programs. Syntero is a counseling service for people of all ages and populations. Caregiver Connection, Caregiver, and self-care, good self-care activities. And then these are the locations of Syntero's 4 offices: Dublin, where I am right now, Mill Run, which is between Upper Arlington and Hilliard. Lewis Center is our Delaware County location. And then our Northeast office is on Agler Road, not too far from Stelter. And then this is my contact information. Call me at this phone number to begin a caregiver consultation process. I always tell my caregivers to even call after 5 o'clock and leave a message, and I'll be able to get back to you. The program is free. There's no fee for the caregiver consultation program. It's funded through the Franklin County Senior Services Levy and Franklin County Mental Health Levy. And remember, you are not alone. There are many other caregivers, and connect with them. Connect with the agencies and organizations that networks that help caregivers. That way you have a network to reach out to rely on, and to be able to learn good coping strategies and take advantage of services and resources that will make it easier for you as a caregiver, so you're not doing everything on your own. So, at this time, I'd like to turn it back to Lucy.
Thanks so much, Dan. We are here for you to help you stay connected, to help you feel less alone and less stressed